Hello, I'm Hainsworth and I'll be presenting today on our work developing an osteoporotic vertebral fracture pathway at Musgrove Park Hospital. I would like to thank all my co-authors for their help with this project. So osteoporotic vertebral fracture is a very common injury and a frequent source of referral and workload burden to the spinal team. Within this project, we sought to identify the current workload that these injuries have on spinal emergency clinics and also audit the investigation and management of these injuries, and following that, develop a pathway for the management of these. As part of this, we undertook a retrospective review of all spinal emergency clinics, looking at the electronic patient records and also the radiology systems from the dates of the 1st of August 2020 to the 31st of January 2021. So looking at our results, 17% of all spinal emergency clinic appointments were for osteoporotic vertebral fractures, with 84% of patients undergoing an X-ray while in clinic. For those who didn't have an X-ray in clinic, this was because they had a recent X-ray prior to attending clinic. 50% of patients were treated with a TLSO, and in all cases this was started prior to attendance in clinic. No further TLSOs were applied for the first time while in clinic. No patients were treated operatively, with all treatments being conservative. So 76% of the patients seen in clinic were discharged or given a patient-initiated follow-up following one appointment. Those who had a further appointment were all seen once more subsequently and underwent a further X-ray and then discharged with no further intervention. We therefore felt that these patients made up a significant portion of our clinics unnecessarily and that we were undertaking X-rays which were ultimately not affecting our management plans. We therefore developed a pathway for these patients, which we are currently in the process of implementing. So the pathways are seen here. So at the time of a referral, we ensure that all patients have a standing X-ray and have been offered a TLSO brace if appropriate. Once the X-ray has been completed, the spinal team review the case and imaging and decide whether it is appropriate for the pathway. If it's not appropriate, then the standard appointment that we made would be a 6-week appointment in the spinal emergency clinic with a standing X-ray on arrival unless otherwise stated. If they are suitable for the pathway, then these patients are sent a patient information letter which details information about their injury, their expected recovery, and also a frequently asked questions section covering aspects such as a TLSO brace and its common problems, driving and returning to work. They don't undergo any further imaging other than the initial standing X-ray they had, and they'll be given a patient-initiated follow-up for the next 6 months and information on how to activate this. We feel that the pathway has significant benefits, and these can be considered both in relation to the benefits given to the patient, but also the department and also to the wider planet. So in terms of the patient, we feel that we're preventing unnecessary hospital attendances, reducing unnecessary radiation doses, and also reducing the financial burden of their injury in terms of them not having to travel to the hospital and do things like paying for parking. The benefits to the department are that we reduce the demand for spinal emergency clinics, which are a limited and in-demand resource. And finally, the benefit to the planet is that we calculated that the reduction in carbon emissions from travelling to and from the hospital is the equivalent of 6 trees a year. So in conclusion, we believe that by creating this pathway, we'll be providing the same high level of care to patients while providing benefits to the department in increasing availability of spinal emergency clinic appointments.